Hi, my name is Anja, and the social issue I have chosen to present is the opioid epidemic. I have created this presentation for my Public Health 205 course with Dr. Fenimore. What is an opioid? Many individuals may not be familiar with the term opioid. An opioid belongs to a class of drugs that is used to reduce pain. Some drugs found in this class include heroin, oxycodones, hydrocodones, codeine, and morphine. All of these drugs are extremely addictive because the medication binds to the opioid receptors in the brain and throughout the body. Currently, prescriptions are becoming the problem. More than 191 million prescriptions for opioids were given to American patients in 2017. As the numbers of prescriptions increased, so have the numbers of individuals abusing the medications, along with the number of deaths within the past 3 years. Looking at the statistics shown on the left-hand side, we are able to identify that there's a chain reaction. As doctors continue to prescribe large amounts of opioids for the various reasons, 10.3 million people have misused the medication. 2 million of those patients have developed a use disorder within the same year, and over 800,000 of those individuals have upgraded to the use of heroin, also in the same year. The main reason for these increases is because the drugs being prescribed are so addictive and can get a person hooked within just 3 days of taking the medication. Effect on public health. Out of 64,000 deaths in 2016, opioid overdose was responsible for 42,000 of those deaths. This can affect any individual, no matter the age or social class. Today's doctors do not analyze the situation enough before continuing to prescribe very strong and addictive medication. At some point in our lives, we will all experience the need for strong painkillers, whether it is for a surgery, broken bone, or any other traumatic event in life. But being able to draw a line, both by ourselves and by doctors, is very important. It takes two people for an individual to become abusing substances. The provider and the abuser are both equally responsible. About 20% of drug abusers receive their medication from a patient that is reselling their prescribed medication, and the remaining 80% of abusers access illegal manufactured drugs. Providing patients with minimal amounts of medication and completing frequent examinations to ensure the medication is needed are very important in today's society. Potential solutions. Just like any other public health issue we face, the public must work together as a team to solve the crisis. This includes doctors, pharmacists, mental health providers, and law enforcement. Limiting funds for medication and requiring more out-of-pocket payments for this type of medication would be beneficial. Today, an important factor for nearly every individual is money. If doctors limit the amount of pills an individual can purchase based on the situation, and then individuals had the choice to limit how many they want to purchase because of the expensive cost, they will most likely only choose the amount that they need. The above statement is a possible prevention of increasing drug abuse numbers, but a form of decreasing the current high numbers would be increasing the funding for rehabilitation. Drug abusers are most commonly at a point in life where they cannot afford to receive help. Providing free or lowered rehab will possibly increase the numbers of individuals receiving help because today's rehabilitation is very expensive. Finally, enforcing laws that limit drug exposure for illegally manufactured drugs such as heroin would also be a benefit for the opioid epidemic. The references for the websites and articles that help me find statistics and complete this presentation are listed below.